Prevention plays an important role in the transmission of HIV, and it should have a place in a person's life. As we have already discussed, we have identified the ways HIV is transmitted. Therefore, when it comes to prevention, the most important thing, and we must not forget this, is the condom. Yes, it has long been proven that condoms provide 100% protection against the transmission of HIV from one person to another. Therefore, in the sexual lives of young people, and indeed of many people who are sexually active, the condom is an essential item. Unfortunately, we understand that HIV infection does not show any clinical symptoms for a long time, and we cannot know what kind of sexual partner we have next to us or what they might have. The second route of transmission, as we know, is through blood. It is characteristic that HIV is a very unstable virus that does not survive in the external environment. That is, for example, if it gets onto the skin, be that HIV-infected blood or skin serves as a 100% barrier against HIV infection. If HIV gets onto household objects like a table or something else, there is nothing to worry about. You just need to wipe it with an alcohol wipe, or alcohol and HIV dies. Here, what is more serious and worth discussing is, for example, in tattoo parlors, hair salons, manicure sets, it's hepatitis B and C. That's a separate topic. There, the contagiousness, that is, the transmission of hepatitis B and C through instruments and blood, is much higher than with HIV infection. And the third route of transmission is from pregnant woman prevention for her fetus. Here, the control is extremely strict because pregnant women are tested for HIV 3 times, at the beginning of pregnancy, in the middle, and at the end. If, God forbid, they test positive, they are immediately given ART therapy, which we discussed earlier. This is the most controllable route, and practically transmission of HIV from an infected mother to her child almost never happens now. The only thing is that mothers are not allowed to breastfeed, so that HIV from the infected mother is not transmitted to the child through breast milk. That's why prevention now is mainly, when I started working, to be honest with you, it was the 1990s, and there was a wave of HIV-infected drug users. That is, people who used syringes, people who used solutions were infected. And the main route of transmission when I started working was parenteral. 90% of cases were transmitted parenterally, meaning through blood. And only 10 was the sexual path. Now, 20 years have passed since I started working at the center. And after 20 years, the situation has completely reversed. Now, 70% of transmissions are sexual, and only 30% are parenteral, that is through drug use. So once again, I want to emphasize the importance of condom prevention. We need to understand that condoms are the protective barrier that young people absolutely need right now, and they should always remember this. I did an internship in America, and I saw their courses and lectures that are given in elementary school so that children understand. And believe me, even back then, this was about 10 years ago, the main slogan in America was that if someone suggests having intercourse without a condom, then well, in such situations, people just walk away, because that's considered extremely inappropriate. Unfortunately, we haven't gone through a sexual revolution yet, and the young people who unfortunately come to see me, when the moment of infection occurs, I ask them about condoms. Some live by the principle of I trust the person. Well, unfortunately, this principle doesn't always work. So I clearly and properly tell everyone, don't be shy, don't forget, remember, tell your friends, your children, there's no need to be embarrassed about this. Make sure to get the information across that this is necessary, because unfortunately, we are still living in the times of the HIV epidemic.